Hey, this is Dr. Mazur here at Cumberland Chiropractic and Sports Medicine, and I just wanted to talk to you guys today about carpal tunnel syndrome. So true carpal tunnel syndrome is when the median nerve gets hung up here and causes numbing and tingling and pain down into the first 3.5 fingers. The median nerve starts right here at the neck, goes through the shoulder, down the forearm, at the wrist, and to the fingertips. So you can imagine if you're in your car and you're reaching back to grab something, that nerve needs to be able to slide through those structures well, because nerves don't stretch well. So the same is true as if you're looking out the window this way, the nerve from your fingertips needs to be able to slide back this way to the spine. So a couple of causes of carpal tunnel syndrome would include a traumatic injury or sustained pressure throughout the day, writers, typers, or anything that requires repetitive hand and wrist motion. A couple of conditions that give you a higher likelihood of having carpal tunnel syndrome would be like obesity, pregnancy, or diabetes. Okay, so there's a few ways you can help yourself at home, and we're going to post the links below this video. But one would be stretching these wrist flexors that like to get really tight. 2 would be a median nerve slider video in which we can get the median nerve sliding through those structures. 3 would be a desk ergonomics video in which we want to take the pressure off of this wrist and bring that keyboard back to us. That way we're not leaving our wrist right on that desk all throughout the day. So we use a few different techniques here. One would be ART, or active release technique, in which we get very specific and picky about which structures are involved. So we'll go in and press on it as you're going through the motion. That way we can get the nerve and the muscle sliding well. We also do laser, we do dry needling and Graston, all of which would be very hard to do at home, but we found these to be amazing things to work on carpal tunnel syndrome. So if you or a friend suspect that you're having carpal tunnel-like symptoms, go ahead and give us a call. If you found this video beneficial, go ahead and give it a thumbs up, share it, subscribe, whatever you got to do. This has been Dr. Mazur at Cumberland Chiropractic and Sports Medicine, where we can get you better, faster.